All right. Hello, everyone. Can you hear me?
Yes.
Yep. All right. So if I didn't hear your response, just keep in mind most people are muted during most of the presentation. There will be times where we'll be asking for feedback and questions. And just to remind you that it is pretty early in the morning, and we sent out this message kind of just a couple days ago. So I'm really happy to see this attendance so far. And this will also be recorded, so there's a lot of people who are going to be watching it afterwards. I'll make sure all the content is evergreen. I'd like to give the floor over to Mike Williscraft because this was his brainchild to get started. All I'd actually encourage you to do is there's a button in the top right that gives you the ability to toggle between gallery view and speaker view. Gallery view can get pretty confusing when you have this many people on the line. You're going to see a lot of little boxes. I just want you to click that onto speaker view. That way, whoever's speaking will take up most of the screen, and it'll just make things a lot easier. All right, and without any further ado, Mike Williscraft.
Thanks very much, David. Good morning, everyone. I think everybody can appreciate the speed with which things are happening, and this presentation was certainly fitting with that. When I first thought about doing it on Tuesday, I wanted to try to have it Thursday, but today seemed like a good day, and I didn't want to push it into next week. Dave has been excellent in working with me and getting the infrastructure set up and the timing. And I know we didn't get the notice out till yesterday, but again, I appreciated Dave noting that he was going to provide us with a recording, which we can post on. I'll forward it to Town of Lincoln. They can put it on the town site. We'll have it on our Grimsby DIA site and Town of Grimsby, so people can take the information that he provides. Some of the interaction and questions from some of the business people who are on the webinar, and and get something from it. On the back end, Dave's also agreed to provide us with 2 15-minute videos expanding on some of the content that we covered today. So I just appreciate his effort immensely here. So I'm just going to hand the floor over to Dean Allison first, because he has some information on some links which we'll be providing also, and Dean has, for any business assistance, and Sam will have a few words just after. So Dean, if you want to go ahead.
Thank you very much, Mike, and thank you everyone for coming on this morning. Mike, thanks for organizing. So basically, I'm going to include a couple links that I've sent to Dave, and I'll send to Mike. They can move forward just in terms of some of the programs that will be available. I realize this is changing rapidly on a daily basis. We see the Prime Minister out every day talking about something new. Just a couple of things that relate to small business, in particular, that the federal government is going to offer up that I think you should be aware of. The first one is that for those of you that may have to pay taxes for your federal business, that's going to be deferred until the fall, and so that's a good news. I mean, obviously, if we could have more, that would be fantastic. But I think that's a good thing that we have until the fall to file our taxes. The second thing as well is that I wish there was just a little bit more, but there's going to provide up to 10% for individuals. So if you've got employees working for you, there's going to be a 10% credit that you will have available to you, excuse me, in order to help keep your employees. So it's a maximum of $1,370 per employee, and it's a maximum of 25. So not a ton there, but still something available. The last thing I'll mention as well, as a small business guy, things are tough. I really don't want more debt. And what the government's provided is up to $10 billion through the Business Development Bank for those that qualify. So I'm not sure how this is really helpful. But once again, for those of you that may be dealing, like, I mean, if we're suffering losses in our businesses, probably the last thing we want to do is borrow more money just to try and get us to the end of the day. But those are 3 specific things that the federal government's offered. There are more in there around EI, GST credits, and all those things. I'm not going to talk about those now. I will leave those in the link that you guys can all have a look at. So thanks this morning for being on so early.
Thanks, Dean. Sam?
Excellent.
Go ahead, Sam.
So thank you very much, Mike, for organizing this, and Dave for facilitating. As was mentioned earlier, Mike, this is really a time right now of a lot of changes. Things are moving very, very rapidly, and our government has been very focused, as you know, in the last week on really the health and safety component side of it, making a lot of moves around the emergency situation and making sure that we're having the resources in our healthcare system, bringing thousands of new nurses onto telehealth, opening up new beds, ventilators, trying to stop community transmission at its source. But we recognize this is an extremely difficult time for small businesses. Really what we are doing is next Thursday, March 25th, we will be tabling our fiscal update, which is where we will be laying out all the measures that our government is taking to protect jobs in the economy and ensure small business owners as well as workers and families have the supports they need to get through all this. And recognizing that in the meantime, we need to have the ideas from people across the province. So I know I've been regularly on caucus conference calls, as well as speaking with cabinet ministers about what some of your suggestions are. So really wanting to hear from small businesses today, as well as all businesses, as we try to get through this with a minimal amount of pain, but recognizing it's a really, really difficult situation. But first and foremost for us is the health and safety of Ontarians, which is why we've taken quite strong actions very quickly. But as was mentioned earlier, this is changing every single day. So we want to hear from people about where they feel the greatest needs are and what we can do to be most effective to provide support. So that's March 25th, next Thursday. We'll be releasing our fiscal update, and that will have the measures that we're taking. As well, I would like everyone, if possible, to know ontario.ca/novel coronavirus has extensive resources, dozens of pages, lots of different links to support both personally for your businesses, as well as statistics and information. There's a lot of misinformation getting floated around, a lot of different people sharing different things online, best of intentions, but that ontario.ca, the official website /novel coronavirus, has all the official information, and that will hopefully provide some clarity to you and your family.
Sam, you could, I'm not sure if my microphone is on. Can you hear me, Sam?
Yeah, I can hear you.
Okay.
You're on.
If you see the chat there, Sam, you could put that link in the chat and send to everyone, and then they could copy paste, and they would.
Oh, okay. Yeah, I can do that.
I see that Dean just sent me, like, as he was going to, the two federal links, and I'm going to copy paste and send them to all, or Dean, you could do that as well, and then people could copy paste them, and then everybody on the webinar would immediately have those links.
Absolutely.
Okay. Were you done, Sam?
Yes.
Okay. So I think we'll just hand it over to you, Dave, and get rolling. I'm seeing that we're kind of adding another person to the webinar about every 30 seconds the last couple of minutes. So I think some people are probably going on and having to download and stuff. So we'll see some people trickle in. But Dave mentioned that he was likely going to stop partway through, ask if there's any questions at that time. So you can put questions in the general chat, or you can send them directly to Dave, and he can address them when he takes a break, or he might click on you for some back and forth, maybe if he's not understanding the question or wants some expansion of it. But Dave, I'll hand it over to you.
All right, can everyone hear me okay?
How do you know?
All right, well, that's just before I mute everybody, so you just told me. All right, so I just muted just with everyone. There we go. All right, I had to unmute myself, but so many people joined. The list started to scroll up there. All right, so if anybody can't hear me at any time or there are any technical problems, please feel free to put a note in the chart in the chat function as well. And yeah, I'll be stopping periodically to ask questions because the one thing I've learned in my 20 years of doing business for myself as well as running an agency where we do consulting for other people is that every business is different. So just about every tip I give you will have some slight customization all the way through. But I believe I've prepared something based on true research and development, also experience that will inspire a bit of confidence. We're going to have some hard truths, but I think that things are not as dire as some people may first think, mainly due to technology and how we can actually connect, online and in different ways. So I'm going to get into all those details. But first, I just want to thank Mike for organizing this and the whole organization. I want to thank our friend Sam Dean as well in the government. This is going to be really important for all of us to work together going forward. All right, so just a little housekeeping for people who've just joined. In the top right-hand corner, there's a little toggle. It looks like 9 little boxes, looks like little dice. If you click on it, you have 2 options, gallery view and speaker view. I recommend you go to speaker view, otherwise you're gonna see a ton of little boxes with everybody's face on it, and I would like you to see my face. I think I've dressed the part a bit, so hopefully I'm not too bad to look at. So if you stick to speaker view, it'll be easier to follow along with everything. That way, anybody who is speaking is going to take up most of your screen. All right. And I'm also putting in the chat function here my direct email address. Don't spam me, but send me any links or questions that you may have that you want to be included in the recording. This will be after the fact. Obviously, if you want something done right now, answer a question right now, put that in the chat box. And if I'm looking down, I'm looking at the chat box, but I'm going to try to look into the camera as much as I can. So to start off with, I just want to address some fears that are going on there. I think that this is obviously an unprecedented situation, but we have been in unprecedented situations before. And I want to start with kind of this big picture view to understand that there is several stages to what are called black swan events. These are the business term for just a negative event, negative to business that happens very, very rarely. And I'm going to be going through some of the stages of black swan events and some of the lessons we can learn from crises of the past. If you look back, just about every 10 years, there is a crisis that everybody thinks is going to destroy the economy. And lo and behold, people are still employed years later, and sometimes, even greater amounts of wealth have come out of crises as well. I'm going to get into all of that. But to start off with, I want to talk about COVID-19, what we do know and what we don't know. And I want to assure everybody that I'm also going to let you know a little bit about myself. If you haven't looked me up, I am a professional speaker. I speak on stages around the world, and every single thing that I put in my talk is researched. I have a reference for every claim or every fact, and I think that's really important. And going forward, if you're sharing information with the public, that might be a good policy for you to adopt as well, that you can back up everything that you say. There's so many times where we have opinions about something important that's going on in the news or in the media, and if we really track down where we heard those opinions, it's like some guy told us and it sounded truthy. So I want to try to get away from that, and I want you to know that everything that I'm talking about is based on the data that we can see. So to start off with, a little bit about COVID-19. There's a lot of information out there, but there's actually a lot of misinformation too. So this information is from the CDC, as well as some industries that are really stepping up with best practices. So first off, COVID-19 is called novel coronavirus. The reason it's called that is because it was never seen before. The coronavirus is similar to the SARS virus. It is a respiratory disease, and the corona phrase comes from how the virus is coated. It has this little kind of layer of fat with little spikes coming out of it. And one of the things that people don't realize is because it's so new, technically, there's no products that are officially rated by the FDA or CDC or any government organization as killing the virus. Now that caused a lot of panic, but I want to explain that for a second. That is only because the thing is so darn new. To get that official rating by the FDA or the CDC, there's a lot of testing that has to go in because there's regulations. You can't just put something on a label. But we do have testing with similar viruses, other coronaviruses, and the really good news that I want to start off with is that it appears as though this coronavirus is very similar to others, and as a result, it's actually really easy to kill. It is not a strain that is, very resilient to disinfectant, for example. On surfaces, in areas, it seems like very little disinfectant will go a long way, and that has to do with how the virus is enveloped. You can get into more science later. I actually have a science background. I worked in nanotechnology and design engineering for many years, so I've worked with people in consulting on how to get medical messages to the public. But even me, I don't want to go too far down this rabbit hole. We could talk about the actual science of it for ages, and you can look that up. But just suffice to say that the way the virus is constructed, it's actually very fragile when it comes to disinfectant. Another important thing to keep in mind, and I checked this as of this morning, so it could change because things change very quickly, but another thing to keep in mind, according to CDC's website, there is no officially known direct transmission from surfaces. So here's what I mean. Coronavirus, I think one of the best ways to think of it is like the flu virus, where the vast majority of infections come from direct person-to-person contact. You shake someone's hand, touch something that had their saliva on it at some point, because we wipe our mouths or something with our hand. It's on our hand. We don't realize it. Our hands are actually very good incubators for bacteria and viruses. We shake someone's hand, and then we eat food, and that generally is believed to be the way we transmit the majority of these sorts of viruses. Although we can't guarantee it hasn't happened, the CDC has yet to document a case of somebody, say, touching a surface or touching a steering wheel or a doorknob and getting sick from that. Although we do believe theoretically that can be done. In my research, it hasn't been officially documented. Now, I don't want to start saying that there's no risk out there, but I just wanted to say that this is the main medical reason why people in the medical community are talking about social distancing. We are going to talk about disinfecting locations. I have a number of options for you and a number of best practices for you. Of course, we want everybody to disinfect their locations, spray down surfaces and everything, because we do believe there is transmission that can happen from that. But the vast majority is person-to-person, personal contact, and that's really been leading some of the desire to get rid of large gatherings, to limit person-to-person contact. And there's a whole movement in business called no touch, and it's like no touch delivery, no touch delivery of services, things like that. And I'll get into all of that in just a moment. But to finish off about the virus itself, it is believed, although again, they don't have the specific regulation because of the testing, it is believed that anything that would be a decent disinfectant for, say, a flu virus or a cold virus will work just as fine for COVID-19. I just want to dispel any myths that it's some sort of super bug. The real challenge with it is that it's very easily transmitted person to person, but it's not the most resilient thing. Ordinary, a little bit of bleach mixed with water, a little alcohol solution. We got our disinfectant here, little things like that do a great job as far as we know, and we do know how to limit that. The other thing I wanted to talk about is the current plan from governments around the world is kind of best phrased as containment, and there's a phrase you'll hear going around a lot called flattening the curve. And what that refers to is, if you're looking at any charts, as a lot of people have looked at a lot of online charts of the number of people infected in different areas, and whether that's gone up, and how many people survive, and how many people are recovering, and things like that, all of those stats. The curve is essentially that every single day, if you keep on getting more and more cases, it's considered going up on an exponential curve. So that's where a lot of the panic comes in. At this point, at places outside of China, according to the latest data, the curve is still going up. But I want to explain some of that data a little bit, because I think people are unnecessarily afraid. You should be cautious, you should take precautions, you should be intelligent. But I think the fear and panic has come from this idea that we're somehow entering this dystopian Mad Max world where I think people have watched too much of The Walking Dead and the zombie apocalypse, and we think it's here now. And I just want to explain some of the numbers. So, and this comes from recommendations from medical personnel, but I'm just kind of, my interpretation. But essentially, the reason why they want to flatten the curve is simply so that the medical community is not overburdened. Hospitals, clinics, things like that. There's only so many professionals, right? There's only so many doctors, there's only so many nurses. So they can only treat so many people who are sick at any given time. The goal with containment is that we know people are going to spread the disease a little bit, even if you're contained. Say one person in a household has it, there's a high chance that other people in the household will get it. So it'll still spread, but the idea is that we will have a limited number of new cases eventually, and that flattens the curve, and that allows the healthcare community to continue. We want to avoid a situation where there are thousands that are infected that are just in the streets or something, because that gets it out of control. Now, the reason why you shouldn't panic is because one of the main reasons why this growth curve seems to be going up exponentially is because of good testing. It's only within last week that America and now Canada has had a decent amount of test kits. So and when I say a decent amount, it's actually in my opinion, a very paltry amount. And I'm going to talk about what's been happening overseas in Korea, where there's hundreds of thousands of tests going on a weekly basis, things like that. But the point is, right now, a lot of the stats were kind of skewed because we didn't know how many people were infected. And now they're getting detected, which is good. The test strips are coming back, and we know who has the virus and who doesn't. And in that early stage, when we're finally getting testing back, it's going to appear as though the virus is out of control. But in actuality, those people were sick already, we just didn't know. You understand what I mean? That's kind of how stats can fool you. You could have had somebody who was infected, say 2 weeks ago, but the stat didn't show it 2 weeks ago because we didn't detect it. Now we're detecting everybody, so the spike actually, according to data scientists and everything, it's unnecessarily aggressive. You shouldn't panic about it. A lot of that spike of new cases is because we're finally getting our act together and testing people properly. That's also why you see a flattening of the curve in Asia, because they've been testing people for quite some time, and that big spike in the beginning from those early onboarding tests is not as obvious in those other countries. So I wanted to kind of set that aside right now. And just kind of let you know some of that data, some of that numbers. You're going to be looking at these charts for the next few days and weeks, and realize that the medical community is still just in the process of testing more people. When somebody's tested, they go into quarantine, and all sorts of procedures are done. So when you see that, I do expect that number to keep on spiking. I worked in medical device and diagnostics and testing, so I know exactly what that spike looks like. But that doesn't mean that those are the number of new cases. Those are the number of new cases that are detected. And that's a big difference. We're finally detecting it. It's a good thing. We should feel good that we're discovering all these cases so we could do something about it. But there will be a bit of panic ensued when people just see that straight line, and then they just extrapolate, well, in 2 weeks, we're going to have 1 million people, and so on and so forth. And I think that is overly negative thinking. The other thing to keep in mind is that there have been some loosening of regulations that have allowed some early research going on. There is an at-home test kit that is projected to be on the market in America, at least, and I assume it'll be available online. And they're talking about actually having it available within the month of March, a very, very aggressive timeline, incredibly aggressive from what I know from medical diagnostics, to get something to market. And there's also drive-through testing that's being set up in certain states, and the Canadian government is working with partners there to see what they can do there. So the point is, it's so early. I don't want you to look at the numbers and panic as much, because a lot of those numbers come from finally getting our testing together. Oh, and there's also a lot of talk of a vaccine. The reason why mumps and rubella and polio are not major problems in today's society, and they were devastating in the past, is because we have vaccines. And I think that I think that that's probably, this is my own personal opinion. This is not based on a link, but in my own personal opinion, based on my experience, I think that's what's going to give consumer confidence back when we have some sort of vaccine or something that will fight this. And they're fast tracking that to the point of may have early trials within weeks instead of the years that it usually takes. So I just want to give a bit of good news and a bit of instruction about those numbers so people can understand what's going on. So right now we are in what we would consider the early stage, or the first phase of the crisis, and basically that's sheer panic. People are just afraid. And again, I think it is because we've watched so many of those of those zombie apocalypse movies and the Mad Max stuff. And I got to tell you guys, the real world rarely follows that. I mean, even Mad Max wouldn't follow Mad Max. Just to go on a tangent, that whole dystopian future was about a future where everybody runs out of gas, but everybody's driving a muscle car and trucks and shooting flames out the back, wasting gas. In the real world, Mad Max would drive a Prius or ride a bicycle. I mean, when we think of some of this, I'm not trying to be too flippant here, but when we think of some of these things, we get so scared because we've been inundated with this idea that society is this kind of teetering on the edge of collapse and just one thing will knock it over. The fact is, society has been there many, many other times in the past, and I'm going to show you how we tackled it then. Before getting into a bit more about the Black Swan event, I want to talk a little bit about disinfecting. A lot of people are running through this stuff really, really quickly. And I want you to know, because of what we know about the coronavirus, soap appears to be just as effective, if not more effective, because it attacks that envelope of the virus. In my personal opinion, soap is really, really cheap, and this stuff is really hard to get a hold of nowadays. So I would just suggest wash your hands over and over and over, and save this for disinfecting your electronic devices. Put this on your car keys, anything that you touch on a regular basis, because obviously this won't damage your phone, but running it under a tap of water will damage your phone. Another thing about your personal routines when you're washing, we've heard a lot about how to wash and that you're supposed to wash while you're counting 20 or 20 seconds. And I wanted to give you a little bit of science behind that, because some people don't do things unless they know why. The reason why you should wash your hands for 20 seconds or 30 seconds, something like that, is actually because hand washing and soap is a chemical reaction. A lot of people think you just put soap on your hands and then rinse it off. That takes all the dirt away because that's all you can see. But when it comes to going after viruses, soap is actually to go into the science a little bit, soap is a molecule that binds to fats. It basically binds to lipids or oils, and the coronavirus is surrounded by fat. But that binding is a chemical reaction. Think back to high school when you poured a beaker into another beaker. It took a few seconds before that chemical reaction started to happen. That's what's going on your hands. So there's lots of examples. You can see these sorts of things online, but essentially what you want to do is, it's not so much that you have to scrub for 20 seconds and everything. It's just the soap has to be in contact with your hands. You swirl it around and just, I mean, I still scrub, but you could theoretically just leave it on your hands for that full 20 seconds, then wash it off, and you've washed off the virus, because it takes a while to bind to the virus envelope. And that's something a lot of people don't realize. Your hands feel clean, but if you do 10 seconds, you didn't actually get rid of the majority of that virus. So really get into the habit of it. I have a 5-year-old son at home, and he says his entire ABCs while he's washing. And I think that's pretty good practice. I think I'm going to put that up on TikTok or something. It's adorable. Yeah, any younger kids in your family, anything else like that, get into those sorts of practices and habits. Another important thing is the washing of hands can be probably the single most important tool you can do. You can ask any healthcare provider. There are, of course, we have seen people, wearing dust, masks and things like that. We have them here, and I'm going to talk about how you might want to use that in a professional setting to give confidence to your customers. But at the end of the day, the biggest risk for transmission is what you touch. So another thing that people are doing in their work is they're putting on rubber gloves or vinyl gloves. And this is great, a great practice. There's nothing wrong with it, except you don't want to stock up on so many rubber gloves you don't leave any for anybody else. I actually had masks and gloves. I had a few boxes of them ahead of time before this virus actually hit, because of some of the work that I do. It's construction stuff, so I had gloves to put on for that, and I do some design and engineering, and you have to put gloves on for that. So I had some around, but a lot of people don't realize this is, a lot of these things, this is from a Home Depot store. You don't have to go to a medical place for it. But here's something you have to know about gloves. Gloves do keep the virus from touching your hands, which is nice. But if you touch one surface and then you touch, say, a customer's hand, you could be transmitting the virus. You could touch someone who's infected, and then that could be on the glove for a period of time. And, obviously you want to take the gloves off if you put anything in your mouth, but just rubbing your eyes or touching your mouth, touching your nose, that sort of thing, with the gloves on and with the person's saliva or virus on there, that can put you at great risk. So what I think is the best thing about these gloves and these masks is actually that they are a mnemonic. And if anybody looks me up, I'll tell you a little bit more about myself in a few minutes. I'm a memory expert. I'm in the Guinness Book of Records for memory, and I love memory techniques. And by the way, I am also local to the Niagara Falls area. I live here in Niagara Falls. I run a business in the States. Just so you know, I wasn't, imported across the country here. I know exactly, the challenges, especially with the tourism going on and everything in this area. So when it comes to the virus transmission and wearing gloves, it is a really good practice, but the best part about it is it's a mnemonic. Having that glove on will probably be a reminder not to touch your face. If you go up to touch your face, the glove on it will remind you not to touch your face. And if you have an itch or a scratch, what I've been doing is you grab kind of the inside of a shirt and you rub it or something like that. Don't rub with the back of your sleeve, because you're doing that when you're touching other people too. So the most hygienic thing is just grab a little Kleenex, blow your nose or rub an itch. Little precautions like this make a big difference, because it's that touch-to-touch contact that is by a huge margin the biggest risk. And the reason why it's really important to have us talk about this in a business talk is because that's the kind of communication you have to have with your customers. You have to educate them so they're not panicking. There's a lot of people who think that, you can just be in the same room with someone breathing and you can catch it. And theoretically that could be possible if there's some droplets in the air, but it's just such a small actual risk, when the biggest risk is our habits of shaking hands, touching people and touching things, and then eating food like a hot dog or pizza or something where we touch the food that goes into our mouth. That is the vast majority of the risk. All right. Another thing that I want to start off with is your own personal routine. Most of us have switched over to working at home. I am going to talk about brick and mortar businesses that can't exactly work remotely with customers. There are solutions, there are ways you can restore consumer confidence after a certain period of time. But for everybody who's working at home, I want to give you some tips here. The most important thing is to get into some kind of routine. Check in and check out. Check in with your employees and check out, at different stages. Treat it like it's a job. Give yourself your own personal space. What you want to do is have a desk or some other area where you are secluded and alone. You don't want to be doing your work at the kitchen table. You won't be nearly as productive. And at this period of time, you really do have to be productive, because this challenge is not going away very quickly. This is going to be a big deal. Another thing that is really important is to set goals. There's several stages to this crisis that I'm going to talk about in a few minutes. For every one of these stages, you should be sitting down and setting goals. What do you want to accomplish? What do you want to do? And you may also make a list of what your advantages are in this crisis and what they're not. You might have more free time that you can focus on a project that's really been holding you up. You might have less free time, but you're expanding your social media presence. There's a lot of people who are online that typically are not, and you can expand that as well. So think of what your strengths and weaknesses are. I'm going to expand on some of those other things in a bit, but it's really important psychologically to set goals and move forward. In survival situations where people are dropped off in the Amazon, or for a military reason or something like that, every single expert on survival says that you have to set goals. You have to be aiming towards something, because when you're on your own, when you're alone, you're outside of the office environment, you don't have somebody cracking the whip. You've got to crack your whip, and it's your goals that will actually crack that whip. That's the psychological side of things. And the other thing I want you to know is I don't want anyone to make any rash decisions. I've seen a lot of messaging from business owners where they're just going to close up shop or shut everything down. Now, in some cases, it might not be a rash decision. There's some, obviously, there's some event spaces. There's some people who put on events for very large crowds, and they have to stop that for the time being. But what I think you should be focusing on instead of making these rash decisions of just dropping everything is see how you can transition. That I know several people, because I'm a professional speaker, I know a lot of event planners, and the really smart ones tried to transition early to do online events. And the technology is very robust. You can see we're doing this here. Up until now, I barely used Zoom for more than 1 or 2 or 3 people at a time, and now we can have a discussion. We can have something really productive. And I'm a business owner. I'm hopefully giving value to you guys, which are the customers, and that's a transaction, and that's what's going to keep the economy going in this time. So think about how you can transition, and also, I think you should have a passion project. You should have something that you're working on that keeps you going, keeps you motivated, because everybody seems to have this point where they're just breaking down. There is a panic that sets in when there's an early crisis, and you shouldn't have to feel this way. So find something that really motivates you. Set aside time for it. Use this as a time to reconnect with your friends and family. And try to take care of your own mental health, because the strongest of us can have tough days. And I'll tell you, I've had a lot of tough days. I run an agency. I've got employees. I've got a lot of things to worry about. I have property and tenants that are dealing with the same thing in Buffalo. Normally, I could just hop in a car and go take care of it, and I can't, and I have to figure out a way around that by working with other people, and it is incredibly stressful. And I think I'm one of the lucky ones, to be honest. The stress that other people are feeling is immense too. So you have to make a plan for your own mental health. You have to set aside time and space for yourself. I got a question come in. Yes, I am going to explain why it's important for business operators to when they get all these inquiries. I'm going to be explaining all of this stuff. I'm going to get in a lot more business stuff a little bit later, but I wanted to talk about you as a person right now and what you should be doing. So the hand washing, the psychological effects are really, really important. You're going to have to be strong for other people as well. One final thing is that if you're thinking of just selling all your stock and shutting down the business or something, or you're just panicking, realize that this is probably the worst possible time to do that strategically. Now, I'm not saying that your business model will even survive. I'm not saying there isn't risk, but the fact is everybody was a little terrified in the beginning, and it's starting to ease up. People are starting to be a little less scared. But because of that panic, people were just not buying for a certain period of time. And that can make business owners very, very terrified. Let me tell you, my prediction is that there will be a time where we will change to something that I call the new normal, where the virus will still be active, they'll still be fighting it, but business will be continuing on in a different kind of normal. There will be a protocol for transactions between customers. And I'm going to get into what I think those protocols should be, what other businesses are doing around North America and around the world to set customers' mind at ease, and actually how some businesses, believe it or not, are actually growing during this crisis. Okay, so to start off with, the major stages of a black swan event, the three things that I want to let you know is that life always does go on. There have been times, I'm going to mention a few, like there was like oil shortages in the 70s, price booms in the 80s, 9/11 in 2001. There's the financial crisis of 2008, and there's of course many other examples that we can look to. In every one of these cases, though, there were people who were thinking it was the end of the world, and we got through that. In fact, wealth grew to all-time highs afterwards. So we're going to get through this. The question is, what is going to be your strategy to get through it? And that's what I'm going to address here. But the first thing I want to say is life goes on. It really does. The demand for your products and services hasn't gone away. The people still exist, and they may be getting a pay cut, but they still have money. Money still circulates. And I would like to think proactively about this rather than reactively. I want to encourage all business owners to try to hustle right now more than anything to keep that economy going. What we do in this early stage and how quickly we can get to that new normal where we're doing transactions, running the economy as normal, and the virus is still out there. We're just taking precautions against it. That is where a lot of other countries who were a little earlier in this pandemic, where they're actually at right now. Like I'm going to talk about Korea and what they're doing really well. But the other thing is that you want to be aware of is that people do adjust. So in the first, I think, it's safe to say that we're kind of in the second big panic week in North America, and people are already starting to adjust. If you look at Korea and Japan and some places in Southeast Asia that have been dealing with this for a long period of time, because they were the first to go, the panic set in, and it took them a long time to adjust, but there have been some great best practices. In Korea, for example, they were one of the hardest hit, and they have not even closed down travel. This at the time of this recording, and last time I checked, they haven't placed major restrictions on travel. They've actually been able to keep the economy going pretty well, and most of the way they're doing that is by testing and tracking. They're doing tens of thousands of tests per day. It's all voluntary, and then the people who do test positive, they're actually tracking them based on their phone. They can tell where they've been in the last couple of weeks, and they actually put that all on a map, and everybody who sees that map will know what areas are potentially infection zones. Now that model has actually been adopted a few other places. Buffalo, for example, just did this recently, where there was only, I believe at the time of this recording, there's only a couple of known cases, and they came in through travel in Erie County and in Buffalo. But almost immediately they have a map up saying that this person traveled to the Galleria Mall, and this person traveled here and there, and so unfortunately, those places are going to see a large dip in traffic because of that map. But what happens is, in those situations, is other places are deemed safer. People can still travel there and still do business. And what happened in Korea, and what I think is going to be happening here, is we're going to start having maps of places that an infected person visited. And then that business owner can actually take steps. They can have a cleaning crew that can come in and disinfect, and they can make the news essentially, and maybe even have their place removed from the danger zone of this map. That's what's happening in a few other places. And I'm going to talk about which cleaning crew and what they should be expected to do, and there's some that are really responding to this. So my point is that things are still kind of in flux here, but if we look at places that have been doing this for quite some time, Korea is a great example, and a lot of people are following its lead. There is a formula to keep business going. There is a formula to keep the economy going, and because out of sheer necessity, some people are starting to adopt that formula, and I would refer to it as test and track. The people who have been tested positive track where they have been, and then make that information known to people so they can avoid those places. And as a result, people feel safer going to other places. Right now, there's been a lot of announcements by the government in Canada to, talk about what sort of, what sort of steps they're taking to contain the virus, what sort of, economic measures they're going to take. But on top of that, there is there's not a lot of guidance for what is safe. They're very cautious to say that, and I think obviously for good reason. They want to make sure they get their information correct, and this is so new you can't honestly say with 100% certainty what is safe. But as time progresses and we have more research, as at-home testing kits, things like that, we are going to have kind of a safe and not safe protocols. One simple example from Southeast Asia, Thailand has allowed travel from foreigners to come in, but they have to have a certificate of that they've tested, that they've not tested positive for the disease. So they have to go to a testing clinic and test negative. Now, they could still technically maybe catch it on the plane or something, but it's at least a step, it's at least a protocol to limit the amount of infections. And that's, kind of a policy that just popped up fairly recently. I think a lot of people are going to have that kind of policy because we have to figure out a way to have business continue as usual. Now, if we look back from a business perspective, aside from the personal perspective, obviously the number one priority is keeping people healthy and safe, ensuring that our elderly and our children are going to be safe and not come down with the disease. So some of these protocols are much more strict at nursing homes, and of course the keeping all the kids home from school will probably be a protocol that will keep on going. There is, thanks very much, Donnelly. 211 is a television information service that people can find out more information. And there's similar things in Canada. We're going to have some more information in the links. So looking back, I want to just kind of go back to some other Black Swan events because not to minimize what we're going through right now, it is of course very, very different. We haven't had this pandemic before. I think we can learn a lot from these other Black Swan events, because if you look at the news articles at the time, everybody thought the world was ending at that time too. So if anybody can think back to the Carter years or the 70s, if you're there, you think back to that, you remember that there was cars lined up around the block, sometimes for miles, trying to get gas because there was gas shortages. Later on, prices for oil spiked incredibly, and it was hard to afford to fuel your car. This was when it spiked up in the early 80s. But if you look at those times economically, they were actually tremendous opportunities for some businesses. Vespa, for example, just a dry throat. Don't get scared. Vespa, for example, its business took off around that time. Same with Harley Davidson, motorcycles and mopeds, things like that. And also that's when around the 80s is when Japanese imports became incredibly popular in the United States, because they took less gas right at a time when gas prices went up. So these things have these are market forces that actually provide opportunities for some businesses. And is what I was saying to a few clients just a little while ago in a stream. A true entrepreneur is never unemployed. You may have to be creative. You may have to find a different way to deliver your services, or have new services that fit the new paradigm, but you're never unemployed. You have something of value, or you're not in business, right? And you just have to find a way to deliver that value differently. And this has happened many, many times. Looking back at the crisis in 9/11, that's the only other time that I could find that travel was restricted so severely worldwide. And if you actually remember back to those times, I'm old enough to remember back, and if you're not, then that bothers me. but for information, back in those times, I was actually doing a lot of interviews in radio and TV, and I remember when there was a terrorist attack. All the media could talk about for a certain period of time was that attack, and I was basically, out of business for a period of time. But then people adjusted and it became a new normal. And if you also remember back to that time, 9/11 wasn't just the only event. There was an attack on a train in Spain. There's a bunch of other different terrorist attack that happened over the course of a couple of years leading up to the Iraq to the war and everything else. But my point was that in between each time, there was that same pattern we see, that the consumers panicked. They had to know every bit of information, but then they got back to normal, and business went back to normal. I did a lot of business during the height of that time, and I was selling an info product that was to improve your memory, and it was things like that. Certainly, it wasn't like bread and toilet paper. It wasn't an essential service. It was a kind of a luxury, and I still did very well during that time. So keep in mind that these things do happen again and again. Now, of course, travel was restricted at that time, as it is today, tremendously. And I have a client who is a travel agent and actually runs an organization, works with thousands of travel agents, and her income has gone almost to nothing overnight. But she also has been in these situations before, and she knows that the travel restrictions are going to open up because they have to. It may be a month, it may be a couple of months, but they are going to open up. Whether or not people think it's the right thing to do, they are going to open up eventually because they have to. You cannot restrict it for too long in an economy like this. So there's probably going to be travel, and then there's going to be certain protocols with that travel. There's going to be testing and things like that. And like I said, 9/11 had the same thing. Travel was a lot of people were getting out of the business, and people thought travel and tourism was dead and was going to be dead for the next 5 years or so. And if you actually look at the stats, within about a year, it was at an all-time high. And not to say that this will mirror that exactly, but I'm just trying to say at the time everybody thought the world was over, and it wasn't. Actually, travel was at an all-time high afterwards. If you look at the chart of the number of people traveling, there was if you look at 9/11, it was this dip, and then right back to that normal and off to a whole new high. So the 2008 housing crash actually saw major firms, right, Lehman Brothers and everything, fell apart, and we thought the world was going to end then, and it was actually sowed the seeds for even new economic booms, in real estate, but it was a huge adjustment for a lot of people, and a lot of people did suffer in those times, but well, there's also I don't want to try to trivialize what people are going through, but I just wanted to show a few of these examples of how there has been a silver lining. Every time there is something terrible that happens, there is still a demand, and people find a way to fulfill that demand again. So my example from 2008 is a lot of people suffered, but also that's when Netflix became a thing. It was just this fringe thing before 2008 because people were trying to cut costs. Then they thought, cable was a luxury, so they cut cable, started going on Netflix, and it destroyed Blockbuster in that time. And now we know what a huge behemoth Netflix was. If you actually look back to that time, hasn't been that big for very long. And it was that crash where people were just looking for a more affordable option that made it rise to be, worth billions, maybe trillion at this point. So they're the same thing with the, the Vespas, skyrocketed when gas prices were really, really high. So I want you to just kind of think that way, think creatively in this crisis, what is going to go up in demand, what do people want even more, and what are maybe things that people want even less, and we're going to talk a little bit about that. So the way I see this this black swan event, and this is based on more than just my prediction, is this early stage of panic and everyone kind of holding onto their budgets, shutting down, not buying anything. That conceivably, and I believe it's going to last maybe weeks, a few weeks to a month or so, maybe 2 months. It's hard to make predictions in this. I'm not trying to be too dismissive because it's a very, very complex thing. But the point is, people still need products and services, so they can only stop for so long. And then once some people start buying, other people are going to feel safe, and it starts to roll again. So that panic mode for just for a few weeks to a couple months is where we're at right now, and it looks like there's no end in sight. It looks like nobody's buying anything, and people have, you know, a lot of reason to panic. But these sorts of things don't last for very long. If you look at black swan events going back in history, you look at all the charts, there's this big spike down and then a creep up almost instantly, according to the data. So that is the early stage. And I'm going to talk to you about what to do in that early stage. But I want you to also prepare and think about long-term, this middle stage. The middle stage will last for months. You know, you can't eradicate the whole virus from every population across the country or around the world within a few weeks, even if everybody stays home. Oh, yes, and message from Rebecca. Yes, so she was asking, you know, a few weeks realistically is the death knell for many small business, special local restaurants. How do you suggest they adjust? Actually, I'm really glad that you mentioned that, because I have some information for restaurants. I was going to put it a little bit later on, but you might as well stick it in right now. There is a new trend for restaurants. There is a for food, at least. There is actually a at-home services that are spiking. There are restaurants that are growing in popularity tremendously. And I'm actually going to share my my other screen here. I don't know if people can see it. This is I have two things that are marked at Dave Farrow here. This is food delivery apps are switching to contact drop-offs, or it's usually referred to as no touch during this coronavirus. They're seeing a spike. Everybody's staying at home, so they are eating food in you know, in record numbers. They're you know, they still want to consume things, so these food apps are actually trying to adjust. They're trying to keep up with the demand. So local restaurants, you can register onto the food apps, and you can you know, get customers. You can also do your own marketing and advertising locally as well, but you can still be in business. But what you have to do, though, now I should say, in this early stage, there is a shutdown for a period of time, but already in this early stage, many places in the States, and I think it's going to be true in Canada, are offering you know, food delivery service. So you can't have, you know, more than a certain number of people congregating. So your restaurant may be empty, and you may have a bit of a skeleton crew, but you could get through by offering food delivery. But the key here is how you communicate, how you do food delivery. The big trend right now is called no-touch delivery, and that is essentially that nothing touches it, nothing touches the food from when it is cooked all the way to when it gets to the customer, and right up to the point where payments are done via credit cards, no more cash, and the food is left on the doorstep for the person to pick it up. It's not delivered hand to hand. All the delivery drivers wear masks and gloves as well, so that's kind of the trend, and it seems to be a new normal. It seems to be that it's been tried out in several different areas, so this is not when we're just starting out. This is you know, this has been tried and tested in many areas, mostly I will say in the States, but it's going to come to Canada. That's just, you know, you can look, if you want a crystal ball, look south of the border. You know, in some ways, hopefully we don't have you know, they've been handling things better now, but they didn't handle things so good in the beginning. I think Canada is handling things better right now, starting out the gate. So we, you know, we'll have less cases, I believe. But when it comes to business best practices, you can look at what the food industry is doing there. And keep in mind, everybody's home now, and they don't like to cook. So you might actually, if you are able to communicate properly, you may actually see higher sales than you have in the past, because there are many restaurants that are seeing higher sales. Of course, you're going to have things like, you know, pizza and everything, but people do get tired of pizza. So everything that's available on the menu is possible. What I'd really suggest is you make flyers and make you know, statements on social media, as well as in all your advertising, talking about how you're delivering the food and how you're doing it according to best practices and guidelines, how you clean your place according to, you know, CDC guidelines, for example. I'm going to share some of that for us. Yes, Rosanna, she said that unfortunately it's not like that in our small community. People are scared of everything, and the staff is even afraid of going to work. I truly understand that this is difficult, and I'm not trying to suggest that everybody can just jump in and see more business. But I think if you talk to some staff and you talk to them about best practices, show them the science. If you can get some people on board and get back going with a skeleton crew, you can have some some success. But this is, I'm not suggesting for a moment this is easy. I'm just giving you a pathway forward, but it is a difficult path. But as we all know from being business owners, we didn't choose the easy path in life. That's for sure. Running a business is very difficult. I am going to give you a bit more information. We hold off some of the questions. I'm going to give you a bit more information along these lines here, and I'll just jump down further here. One of the things that I want you to also start thinking about before I get back into how to communicate with the customer is step one, you've got to try negotiating. And I'm talking about contacting every single creditor you have, all debts, your lease, whoever you're renting or leasing your space from, every single expense you have, including employees. You want to talk to them and try to get the best possible deal. We have, I know of tons of people who are on the phone with the tax department saying, hey, my situation is unique and different. I want to be, I want to get into a different payment plan or skip this month's payment or something like that. And I know that, the MP, MPP were talking about some tax relief, in general, but that doesn't take into account all of the bills we have to pay, right? Tax is just one of them. So I want you to contact every single credit card, every single, well, actually, I have a few examples here. All your vendors, all your suppliers, any lease agreements, and your staff. You want to be honest with them about what you're predicting. You want to try to get out ahead of this, but you also want to give them a path to make money. To say, hey, you're going to make less, but here's how we can go forward. And I think that if we make this transition quickly, we can be ahead of the market. And we can make a difference. So, but first step is negotiating. Negotiate. Try to get as good a deal as you can from every single one of those those expenses. And I'm speaking from experience. I'm doing the exact same thing myself. Tammy, my client who's in the travel industry, first thing she did was she got on the phone. She actually has a tax thing with the IRS. She got on the phone. I don't think she'll have a problem mentioning this because she's a great entrepreneur. But she was able to get her payments down to something like $25 a month for a whole year or something like that from a very, very high payment. I've seen people make deals with credit cards and get interest relief, get credit cards that have a balance and they're lowered to zero balance. It seems as though people who are connected to travel and tourism get the best deals. So if you are in the Niagara region, make sure you let them know that this is a tourism hub. So your business, you're in the tourism business. Even if you run a restaurant here, if you say you're in the tourism business because the majority of your clients are tourists, then that seems to get you the best deal. And I hope that, and that's, like I said, it's not easy, but I hope that advice can help you more. Also, lease agreements. I can tell you, as being a property manager and owner myself, in a small scale, I have renters in the States. I can tell you that it's very, very expensive to get somebody new into a unit. So so this is where you talk to people who are your landlords and your leaseholders, and try to do deals with them. Everybody knows that this is an unprecedented crisis, and if it's a choice between losing a tenant or giving them a break on the rent right now or for the next 3 months or something, I think most property owners, hate to throw you under the bus, but you'd actually choose to give somebody a break. Nobody's going to be evicting people right now because you won't be able to fill the space afterwards for quite some time. So you could argue that you can really save a lot of money that way. So talk to your leaseholders and have that discussion. Oh yes, so you're mentioning that there's been no talk from the government about rent. They've addressed mortgages, and yeah. So I do understand that we want to go to the government for relief. Maybe I'm more of a rugged individualist, but I just take the bull by the horns myself, and I talk to creditors personally, get them on the phone, and make a one-on-one deal. Certainly, the government can step in, and it probably will at some point to help people with people's living arrangements. But you don't have to wait. Jump on it right now, and get out ahead of this. And right or wrong, good or bad, that you tried, that you did your best, and that's what I'm on the phone with every single thing that I buy, every supplier, every lease arrangement, things like that. I'm on the phone with them, trying to get a better deal for a period of time. And that's just it. You just say, hey, my business has dropped down. I can't pay this, but how can we keep the lights on? And you just do a deal, and people will work with you because we're all in that same boat. I wanted to say, I'm going to switch shifts here for a second, and I'm going to bring things open to questioning in just a second. I want to bring up one more point after the negotiation. So negotiation, I think, is your first step after you kind of get your own psychology in order, set goals and make plans and things like that. Try to negotiate for the best possible deal with all creditors, tax, lease, all that stuff. The other thing that you want to be starting to think about is offering different services, changing your services. So I've been looking at a lot of the people who are part of the Small Business Association here, and there's all sorts of different services that you're going to come back and say, well, we're brick and mortar, we're a tailor shop, or we're something else where people have to come in, and it's impossible for us to deliver this content online. And I'm going to tell you that there is nearly no business that you can't deliver online in some way. I've gotten suits made in Thailand, sending measurements as part of a measurement chart. Now, so what I would suggest, though, is that you have some online to offline tools. And so you want to communicate with people about what you can do online, prepare people, get materials, get those measurements, things like that. And then if you are going to meet offline, then you want to make sure that you communicate with the customer how you're doing it. People, when they're in a panic situation, they just want to know that there's a protocol, and the protocol makes sense. If you just say, we'll just meet up and don't worry about it, we'll shake hands, then they're going to think that you're irresponsible. So you have to talk about how you're going to meet up. And most of this is going to be done through social media and local media. Going back to Mike and newspapers, you'd be surprised how much local papers actually can jump in a crisis, because people want credible information. They want to know things right here, right now. They want to know what's going on in the local area. So I'm going to give you a couple of examples of offering new services, okay? First off, the tailor is a great example. A lot of people think, hey, I have to have somebody come into the shop. Well, yeah, maybe for the fitting, but you can get started earlier with measurements and other things online. You can still do a lot of that work. I have a client, Scott Utterback in Texas, who is in construction. And almost overnight, the majority, about 80% of his contracts just went away overnight. And I just had a conversation with him just last night, actually, and he's excited. Now, you want to know why he's excited? Because one of the construction services that he has offered that was not really in a huge demand at the time is cleaning services for construction sites. This is industrial level cleaning to clean up things like mold and lead paint and things like that. We're talking industrial level stuff. He is basically going to do a pivot and shift and focus on that. And there's an interesting product, Concrobium. You can look that up, Concrobium. It is, there's a number of businesses that are doing this pivot as well to disinfecting tools. Concrobium is I'm not selling it or anything. It's not available in this area just yet, but it is, they plan to expand it. It's a natural disinfectant, so you can actually drink it if you had to. It's not going to hurt you. It's all been very well tested and approved, but it'll disinfect surfaces. And his plan is to actually take Concrobium and put it through a fogging machine, and the fogging machine essentially fills up an entire space. You let it sit for a certain period of time, and then air that space out, and it will it will be disinfected according to all of the consumer details, and they've actually had it as an approved disinfectant. Now that material does have a cost to it. It might be cost prohibitive for some people. It might just be cheaper to just have a cleaning crew come through and get a certification. I'll talk about that in a bit. But that's just an example of how he's taking one business that is completely dying, but he's seeing the opportunity in the market and switching over to another thing that's working well. And I'm going to talk about some of the questions that came in, but I'm just going to give you a couple more examples. And then we're actually going to throw it up to some interaction and Q&A here. I'll give you actually, in my case, we have a number of people who are professional speakers. I coach a lot of people who are speakers. They speak on the college circuit, for example. They speak to colleges, travel around. It's a great lifestyle, and it's a really, really good business, and it's providing some really good value. And pretty much when this whole crisis hit, I thought, oh my God, I'm out of business. I'm not going to give a speech for another year because we can't hold gatherings. And I realized even I had that limited thinking, because the service that I offer is I disseminate information, hopefully in an entertaining and pretty well informed way, but I disseminate information. I don't need to do that live. Right. So almost within a day of me thinking the world was coming to an end and the sky was falling and I'm never going to speak again, we got offers for several of our speakers to do some online stuff. This is actually one of the first ones that we're delivering. Others who are planning a little farther in the future. And the speakers are going to get paid to do online things. We have one person who's a crisis counselor and talks about online safety, and she is offering mini classes to these colleges to keep the students there. So what I'm saying is that the demand doesn't go away. In some cases, the demand can go up. In a college's case, I know this is an American example, but in a college's case, they've sent all these kids home. They're worried about losing all the tuition fees from those college students for this entire year, because they don't know how long they're going to be out, and these colleges have to pivot to offer online classes really, really quickly. And speakers can sometimes step up and offer some of that content because it's federally mandated content they have to do on things like diversity and Title IX stuff and things like that. They still have to deliver that content, but now we can deliver it online. A couple of other examples, of doing this pivot. There's actually a local. Actually, I'll talk about the cleaning company a little bit later on, but there's a local cleaning company I'm doing a website for that is offering cleaning and now disinfecting. So they're changing their services to match what people really, really want, and they're using CDC guidelines for it and try to make it affordable for small businesses. So for right now, I'm going to actually unmute people, but I ask that if you don't want to speak, you can mute yourself, and I'm going to ask for some questions to come up, and I'm going to try to unmute everybody to see if it's chaos. If it is chaos, I'll unmute people one at a time, all right? All right, so we're unmuted, and I was wondering if anybody had any specific questions about what I was talking about so far, and any ideas about offering new services. Anyone? Anyone have any questions? All right, well, I'll address the two questions that came in here. Sam, suspended evictions, looking at supports for update for next week.
Regarding, I'm gonna go with him. We're gonna go get this stuff for you.
All right, so all right, so tell you what, I'm just going to unmute people one at a time to make it simpler. If you have a question, put it in the chat box. I'll unmute you. But I'm going to start actually with Sam, and so we can explain what his question was there. Let me find you in the list here. Sam, can you hear me?
Yeah, that wasn't a question. That was actually a response to Roseanne's question about the rent piece. Definitely something that we're hearing a lot about. We did suspend evictions yesterday. We got the judicial okay on that, so there are not going to be evictions for the time being. I know that's small relief to someone who's paying high rent, but we are looking at different supports as well. And again, the fiscal update comes out next Thursday, March 25th, and there'll be more supports there.
Excellent, excellent. All right, thanks a lot, Sam. And Paul, let me find you here, and I'll. All right, Paul. What's the you want to explain your comment there that you've waived payment fees and property taxes?
Yes, good morning, everyone. Not really a question, but just added into the conversation there. So locally in Lincoln, we have waived late payment fees on property taxes, which essentially delays the need to pay your property taxes. So, we're doing our part locally on trying to alleviate, the concerns that small businesses have. So the encouragement is to chat with your property owners to see if there's a delay in rent payments as well. Obviously cognizant of the fact that these property owners have mortgage payments to pay as well, but hopefully they can chat with the bank. So we're doing our part locally. Thank you.
Okay, thank you very much. And Amir, I just unmuted you just now, so you couldn't speak before, but you have a question for them? Dean and Sam? Anna Marie, are you there? I just unmuted you, so you muted yourself again. All right. Okay, so Anamir said, I don't think I have a mic or my mic's not working. So what I've been hearing from members is that they're finding that government websites are very challenging to navigate. They can't find how to apply for relief being offered. Any thoughts on that? So she's having trouble with her microphone. I'm going to open it up to you, Sam, and Dean. Not allowing me to unmute Dean. Oh, here it is. Okay, it was just a little delay. So Dean and Sam, can you hear me?
Yes, I can.
All right. So could you answer Anna Marie's question about how to find the relief?
Yeah, I would agree with that, Maria. It has been very complicated. We're getting tons of phone calls. We're also getting emails into the office. It's one of the things that these are announcements. They haven't quite, in some cases, haven't figured out how they're going to deliver some of these things yet. So right now, we're still working through that, trying to get clarification from the government on that. And that's why I say we'll just, I sent those websites out today for people to understand what it is. A lot of them are through existing programs already. So that, for example, if someone's getting a GST credit, which is not going to be applicable to small business people, they would apply through the normal channels that they normally are. So as information is available, we will continue to post on our websites, and by all means, reach out to our offices anytime.
Okay, and also, Paul, you're Director of Economic Development. Do you want to, Economic Development Officer in Lincoln, do you want to chime in on that as well, about suggestions? I unmuted you, Paul. Can you hear me? Oh, looks like Paul may be frozen. We'll go back to him. Melissa. Melissa, I'm gonna unmute you here, and let's ask here. And you were asking about what do we tell our landlord? Talk to your bank. Some are elderly and not as savvy. So I'll let you continue the question in a second. But yeah, in negotiation, I would say that you have to really be persistent. No one's going to want to drop the rent right away. They're going to want to do some sort of deal, but being persistent, letting them know that this is an unprecedented time, and they are changing. And you can also really say, look, if I can't get a drop in the rent, there will be consequences. I'm going to have to leave, close up shop or something, and I don't want to do that. So what I found in negotiation that works really well is essentially making it clear to people that they have the key about negotiation is consequences. So people won't do something if there isn't consequences, right? So you have to be upfront about if you're afraid of losing your business or you're afraid of not being able to start up again, then you have to be upfront about that and say, unless I get that rent relief, we may not survive. So, you're just going to have to, rent this someplace else. So appealing to what's in their best interest so that they know that it's going to be incredibly difficult to get somebody else into that space. We talked about evictions being put on hold, but I'm also guessing that even if they weren't put on hold, they would be at an all-time low right now because there's a cost to eviction and the chances of getting somebody else into that space in these uncertain times. Real estate is one of the first things that grinds to a halt. So they also are feeling the pinch, and they're going to try to get everything they can out of you, and that's where negotiation comes in. But that's what I would suggest. Rosanna, you wrote your landlord 3 days ago and you still didn't get an answer. Well, write them every day until you do get an answer. Call, text, email, carrier pigeon. You got to be persistent. Mike Delaney, do you want to be unmiked? I muted everybody just for convenience, but I can.
I'm still not muted.
Okay, you're muted again, Melissa. And Paul. Sorry, I should say Paul Delaney. Give it a second. There you go, Paul. Can you hear us?
Yeah, it seems to be working out. Sorry, it was frozen earlier.
Yep,
in the chat, I put my email address. I encourage everyone to just email me, and I'm going to help where I can to answer some of your questions locally and in West Niagara. We're all in this together. So contact info is there. Thanks, Dave.
Awesome. Okay. If anybody, if there are no other questions, I can actually continue on, and we'll do more Q&A at the end of this. But I wanted to continue on with this. Some really good discussions here. All right. So, getting back to, what is it that you actually offer? It's really important to understand that while people are frightened, they're not going to want to buy anything, but the demand doesn't go away. In fact, sometimes it builds up. We're already seeing on social media this kind of gallows humor where people are making all sorts of jokes about the crisis. That's psychologically how people deal with these things. They talk about how, it's the end of the world and everything. And but don't you take this too seriously. The demand is still there. If you sell pizzas, people are dying for them right now, but they're just too afraid of dying, period, right now, so they're not acting. And once some of the science gets out there to the public consciousness, once people realize that you can responsibly buy and sell things, trade products, you can do it in a responsible way without getting an infection, then that'll really, really open up. And the best thing you can do as a business owner right now is to try to communicate this right off the bat. Actually, yeah, Anna Marie, you want to mention about that? She says that please tap on. So we're all working hard to to help spread the word about ways that you are still open for business. Please tap into that on social media, on websites, and everywhere else. Email the chambers and towns, the DIA, join Facebook groups, be out there. Absolutely, that is actually my next point on there. I feel like you're reading my script, Anna Marie. The most important thing you can do is start with past and present customers, people who are your regulars. Get into an email list if you don't already have it. If you just have phone numbers, start calling them and asking for their emails and have online options. If you don't have a Facebook group for your business, start the group and then keep on inviting people. And in this early stage, you've got to be really, really persistent because a lot of people are just hearing a lot of negative information in their own silos. So, but the other side of this is that there are some parts of business that are really skyrocketing right now. A lot of things that are online are growing tremendously. And if you can do part of your service online, and you might even think, oh, there's no way I can do this, like I installed carpets or something. Well, you can actually start to do order taking and other things online. You can do financing and things like that. There's all sorts of different stages of that transaction that can be done online in advance. You got to actually start to hustle, start to think of how can I offer different businesses and different sales, Rosanna's got some great points in there. People can scroll through some of the comments. I'm going to continue. Oh, actually, a good question from Connie is how do we handle gas and hydro payments? Well, we actually have had several crises where people couldn't pay their gas and hydro, and I was wondering maybe if somebody else wants to take that question. Who would like to step over that? Well, okay. I guess it'd be directed at me then. The thing about utilities payments is you really have to call customer service and talk to them and talk about a deal. Talk about deferring interest. Ask to speak to a manager. This is really a conversation you've got to fight for every little penny. Yeah, gas and hydro, they're organizations just like anything else. There's exceptions that can sometimes be made. You can sometimes defer payments. You can ask for a break on payments. And the other thing also is that if you are running with a reduced staff or reduced hours, maybe you're using a little bit less of that going forward, and you can argue that you could be given a deal because you're going to be using less of the services going forward. But that's all part of that negotiation. Plead your case as much as you can and keep on being persistent. The squeaky wheel gets the oil in that case. So I'm just going to hold off on some of the questions. If you can hold off on them for right now, we're going to have another section with questions a little bit later on. The thing I want to communicate in this early phase is don't wait for permission to innovate. This whole no-touch thing, no-touch delivery was created by industry. In all my research, I couldn't even tell who came up with the idea, but someone came up with the idea, and now there are some food places that are doing record business, bigger business than ever before, because everyone's at home and they don't want to do dishes. So that was something that just came out spontaneously, out of the marketplace. It's just, free people, free thinking, so to speak. What can you do to help people? So I've seen a few examples here just to kind of get the creative juices flowing. There is a lot of veterinary clinics right now that tell people to stay in their cars, and they will have somebody that comes out to the car wearing a mask and gloves, and they will take the pet with them and treat the pet, and then then they'll come out or talk to you on the phone about how the pet is doing. And this is just to prevent people sitting in a waiting room, because a waiting room can be a way that you can transmit the disease. And of course, the people who are taking the pets in and out, they are following certain protocols as well. That's just one example of how you can keep the lights on, keep going in a business where you think there's so much person-to-person contact. Well, a lot of these things can be handled. Think of like drive-through delivery. In fact, that's one of the things that has skyrocketed is drive-through options, or some option where you can sit in your car. You might have a brick and mortar store where you don't have a drive-through option. I get that, but you can actually have signs up and you can instruct people that they can sit in their car. You can take their order, and then they can have it taken out to their car. And really, how much more effort is it to take it out to their car than it is to take it out to their table, right? So different options like that. A lot of medical clinics look like they're going to be offering drive-through options very shortly. This is something that was really spearheaded in Japan, where they were one of the first, sorry, not Japan, Korea, I should say, South Korea. They were one of the first to offer drive-through testing. And the idea was that you don't want a bunch of sick people in a room together. That's just, asking for trouble. So they drive through this testing, they take a little mouth swab, they hand it back to the person, and then all they have to do is take control of that mouth swab. So it's a very clean, sterile thing. You don't have to, disinfect the waiting room and things like that. Actually, newspapers. Mike, your newspaper is a really great example. There's a lot of people who thought that any sort of newspapers or magazines are a big no-no during this crisis. A lot of people will be nervous to pick up a paper or a product like that, but you can actually do communication and remind people that for many years newspapers were actually considered one of the sources for a sterile surface. I mean, I don't know how old everybody listening is, but if you can think back to some of those sitcoms in the 90s where it seemed like every single one had an episode where somebody was giving birth, and they gave the little factoid that a newspaper is something that you can give birth into because it's sterile. And the main thing is because it's manufactured and folded essentially mechanically, so there's almost no way that you could get bacteria in there. And it's also, paper and ink, so there's nothing for bacteria or things to grow on, that sort of thing. And I'm sure you have even more protocols. A lot of people, wrap their papers up in plastic bags when they're being delivered, things like that. So communicating that to your customer and letting them know that you have these protocols in place, and also reminding them that there's a tradition that newspapers are sterile. That is something that if you can communicate well, you should not receive a drop in service. In fact, you might even get a growth, as some people have seen. But I got to caution, it has been very hit and miss. People who communicate this well seem to do very well, and people who don't communicate it well don't do it very well. So one of the things that I want to share with you about communication, though. Here we go. Nice question from Melissa. I'll take a question here. If you sell tops or pants or clothing, most folks who have started the transition to sales attempts on websites and Instagram are getting, mostly supportive messages, but not a lot of sales. Suggestions for items which require being, tried on. So items that require being tried on. Well, actually, you can learn a lot from online stores that do this. There is a misconception that because Amazon does something, you have to do the opposite in order to compete with them. In actuality, most people would prefer to buy something locally. They would prefer to support local business if given the option. But if you look at how some of the online retailers have done things, it's really, really a good idea for practices. So you can have selected clothing. You can have pictures of all your stuff online. You can have a very simple blog. We make websites for people that make a landing page for our usual cost for like a landing page is like $700, so it's affordable to get started. You can also use a lot of different cataloging services like WordPress and blogs to host all your products. And you can offer what tends to be a good best practice is offering something in boxes. So somebody can order a few boxes of things. You can open up the boxes, try on the clothing. If it doesn't fit, they can send it back and get another size or something. And you simply inform the client that all of these things are washed and cleaned before they're entered into the box. In a no-touch sort of way. Nobody touches it or breathes on it or anything when it's entered in. And then you can. I just got to unmute people here. And then. If any of the clothes don't fit, then they can send them back to get a to try it again. And having that really flexible return policy, I know that scares a lot of people because you think people are going to take advantage and try out products and then return it. But in actuality, that's a very, very small percentage. People who have had very robust return policies tend to not have any much larger returns than other places. If somebody likes a product, they keep it. It's as simple as that. So you don't have to worry about people taking advantage. There are that 1% that does take advantage of returns, but offering returns for different sizes, size up, size down, something like that is perfectly fine. And communicate that on social media. That brings me to the next point. Social media, the way to use it properly is you want to be direct with your people. You want to use different features for different purposes. So when we think of different social media accounts, they're really for different types of messages. So Twitter should be your breaking news source. Not everybody's on Twitter, but the people who are, they do take a look at it. So it's short messages and it's what's going on right now. So you should send a tweet out every time your store is open, for example. Say, hey, we're open for business from now until X amount of time. It takes 2 seconds to do it. You can train your staff to do it even. And send a tweet out when you're about to close. You're an hour from closing. So anybody have any last minute things, send a tweet out. That's the sort of breaking news stuff. If you changed your policy, if you're offering a new product, that sort of thing. For Facebook, what you want to think of Facebook as is that's the big general audience, and it also has for lack of a better word, all the crazy people too. So what you want to do is make sure that you're double thinking everything you send out on Facebook. This is actually what we do as a policy in my company. We do social media marketing, lead generation for people. We've done this for years, and there are certain things that I would suggest you have to be very cautious talking on Facebook, because you are going to get a lot of people trolling. They'll say a negative comment. So I'll give you one example. If you were to start to say, some comment, let's say, for example, about how your business is losing money, right? You think that's a very benign comment. You say that on Facebook, I know for a fact you're going to get, like, let's say it's a complaint or something, like, oh, we're losing money, we're really suffering, come on, anybody, come on and help us. That can also be interpreted as, you're whining when everybody else is suffering more, and you're going to get some comments saying, well, I have people who actually, are infected, they're in the hospital, and, you shouldn't whine so much. You're going to get those trolls. And I'm not trying to, be too negative about this, but what I'm trying to say is, if you have the right communication on the right platform, it makes a big difference. If you go on LinkedIn, and you tell people, hey, we're suffering, we're losing revenue, we've lost this much, but we're offering some specials to deal with it, you will not get any flack, because that's a business platform. You can talk about business on there. In my case, for example, in this talk, I'm talking about, winners and losers in this crisis. So in LinkedIn, I might refer to something like, there's a silver lining to this. There's more people online now than ever before. Social media has actually doubled in the amount of active use. So the average person is actually posting 8 times a day on social media. That's not just posts; it's also answering questions or messaging people. It's a minimum. In a lot of cases, it's an average of 8 times a day. So some people are doing a tremendous amount. That's up from 4 a day. So it's about double. And if I were to go on LinkedIn, I could say, hey, that's a good opportunity if anybody is in online marketing. You can buy some ads now, and you've got a captive audience, they're bored at home, etc. If I said that on Facebook, people would say, oh, you're an opportunist, you're taking advantage of the suffering of other people, things like that, which is a valid claim. I would probably not say that to a general audience, but I could say that to other business people and say, hey, I could do that on LinkedIn, and people would go, hey, that's a really good idea. So different platforms are for different use. Talking about the dollars and cents of your business, that's LinkedIn. Talking about specials, coupons, hey, I'm going to be open this day but closed this day, that's like Facebook. And Twitter is like breaking news, things that are just happening. I would also suggest you jump up and get into TikTok. It has just exploded, and if you've got any downtime, you can send out a few videos. And I myself, at the time of this recording, I'm kind of been lazy about this too. I should have been doing more. It can reach a very, very large audience. TikTok and Instagram are going to be for visuals. That's going to be for people who you want to take pictures of your store. You want to take pictures. If you're spraying a disinfectant bottle on a countertop, take a picture of it. Have somebody take a picture of that. Put that on Instagram. And also you can put that up on Facebook as well, and let people know that you're taking measures. Showing pictures like this are going to normalize this new world, and you really got to remind customers that you're still in business, that things are still running, because people just think because the schools are closed, everybody's closed down. So getting out on social media and watching that again and again is going to make a big difference. Yeah, so my main point is LinkedIn, you can talk a lot about business. It's poor taste to talk about money matters anywhere else. Facebook is like the lobby where everybody is in, but there's also trolls there because they're trying to get attention by being negative too. So it happens. Don't take it personally if it does happen to you. Twitter is for breaking news, and then Instagram and TikTok, something like that, is going to be for visuals. And I also want to include local media here, the local newspaper and radio and TV and everything, and news. The circulation for these things in this early stage, when people are panicking, you won't see a bit of a bump, but I do believe that as things normalize, you're going to see circulation go up because people are consuming media at an all-time high. All media. So every TV show you can imagine, Netflix, everything is streaming almost to its peak capacity, and it's really testing the limits of a lot of systems. And I would also say that this is a time where you can actually increase your readership for the local paper there, Mike. And I also have it on good authority, not to make too much of a plug for him, but I'm just doing it because it's good business sense. He is offering tremendous deals on some advertising right now because of the crisis. And I got to say, it makes a big difference if something's coming from a local source. So consider that, and consider that even though we're scared to spend money right now, a little bit goes a lot farther because everybody's at home, they're all bored, they're watching and consuming media. Oh yeah, good question from Melissa here. So am I suggesting to reopen periodically with notice or wait regarding what I said previously? Yeah, I think that what you have to do is sit down and make a plan. It depends on your business whether or not you're going to reopen now or you'd wait. I would say that people are still in that panic phase, but you could start communicating saying, hey, I intend to reopen a week from now or something like that, depending on your business. Tell them ahead of time. You can still market that. And by the way, if a week from now something changes, there's big warnings, there's big news, and there's some major outbreak in the local area, you can change your mind. You can say, hey, in light of this new news, I'm extending, I'm going to be opening up a little later on. But in all of your messages, you should also encourage them to contact you directly because you're going to say, hey, I'm going to open up 2 weeks from now, a week from now, that's the date we're going to open up, and we're going to have these sanitization procedures in place. We're going to do it this way. In the meantime, if you have any questions, contact me directly, direct message me, and get in touch with their customers. Kind of pre-sell these people ahead of time. But yeah, there are businesses that haven't closed. There are businesses that keep going. They just change their model of how they do things. Like I was talking about, like a place like a veterinary clinic. A lot of people don't realize you can't really close that. Where are people going to take sick animals? There's some things that are emergencies that they just had to switch on a dime and change almost overnight. Oh yeah, from Mike, we had many people coming, per day coming into the office asking when a particular business is going to open. People are walking downtown, they're trying doors, and they don't know who is open and who is not. So you have customers that are, and if you're the one that is open when everyone else isn't, you have a great opportunity. But I also, I'm going to give you some tips on communication for sanitation, just to kind of finish off this whole thing. So marketing and advertising. We can do social media. It's at an all-time high. You can do local marketing. I'd say if you want to tell people that you're open for business or when you'll be open for business, local media will be one of your best choices as well, because that'll spread very quickly. I will not use the word spread virally ever again during this crisis, except for that one time where I'm making a joke out of it. I say it spreads quickly. And just to remind you, everybody can do at least part of your business online. So try to get that as kind of a pre-sale. Ask people, hey, give me a deposit, for this, and then we'll book something down the road. Things like that. Live stream. Look for events online. Even if you're a business where you don't normally think of live streaming, you could do that. Another thing to think about for this new normal. This is going to be what you communicate to customers, saying, hey, because of COVID-19, we're doing things differently. Here's how. Many businesses, I want you to start thinking of yourself as kind of an assembly line, okay? Oh yeah, selling gift certificates online is a great thing as well. Really cheers people up. See, this is the thing that I think a lot of people don't understand. Let's say, for example, going back to the tailor example, you think, oh, well, I'm out of business. I can't, nobody's going to want a suit in the middle of a pandemic. Well, everybody feels terrible right now. Don't you think there's some people who want to have a suit to feel good about themselves? Isn't that the main reason why people are buying suits? Now, mind you, that might be a smaller market than there was previously, but it's still there, okay? And if you're the one tailor that recognizes that and is able to communicate with it, you survive, and other people are closing their doors, just like Mike was saying, how people are trying doors downtown and they don't know who's open. Yeah, you can look in the messages. Leanne has created a Facebook page to share West Niagara business updates, and I would suggest you go on all of these, including what Mike and everyone is talking about. Go on every possible Facebook page you can find, and make a list of them, and then just say, every morning if we're going to open, tell everybody a week in advance. Hey, it's 4 days from when we open. It's 3 days from when we open, and that sort of thing. And now I'm going to talk a little bit about what we should do when we open here. There is, actually, one final thing actually is, as you know, I have a lot of people who are like info businesses, so there's speakers, consultants, things like that. one of the things that they're doing, a lot of people are actually investing in social media marketing right now because the media is at an all-time high. There's more people watching than ever before. But the best practices I would suggest is you're not trying to go for the sale right away. People, at least at the time of this recording, they're still very hesitant to part with their dollars because they think it's Mad Max, you know, without the Prius, right? They're worried about the future, so they're not buying, but they are window shopping. So let them window shop with you. Let them kick the tires. Gain a lot of leads. My company, we have a lead generation system where we do direct messaging via social media. We can message thousands and thousands of people per month for a low fee, and we're seeing a rise in the number of leads, a rise in the number of engagements. But it's hard to close those sales. So have a long-term strategy. This could be the place where you raise the amount of your lead base, and if you can offer them something really cheap or a deal right now, maybe they'll buy, but they will be your prime customers when we start to reach that new normal. So this might be this is a good time. Actually, a lot of people are investing in that actually quite heavily in some cases. They're really doubling down on marketing for media right now. So one thing I wanted to say is cleaning. This is, if you're communicating with the, and I'm going to open this up to questions afterwards because we're running near the end of our time here. If you're going to open, you should have a cleaning policy, and you should have a transparent policy of everything that you've done. And I'm going to give you what I believe is a really good policy, and it actually comes from, I have a client, they're just getting a landing page with us. It's Niagara Direct cleaning. And I'm just going to bring up the site here. Yeah, so let me just share this with you in my other screen. Yeah. All right, so this is Niagara Direct. I think we're changing the name to Niagara Certified Cleaners, and this is basically like what the page looks like. She's got a mask on, and right under it is we follow CDC disinfection guidelines. My point is there are guidelines out there. There are things that you can do, and we're not finished the site here, but some of the copy is around the time of we are the only we're the cleaners in the area that will give you a certificate of our work using CDC guidelines for sanitization of COVID-19. The certificate documents everything that was done and includes instructions on how to maintain the environment at the same level in the future. This certificate can be posted on the window or on social media to let your customers know what has been done. So this is just a great example of, and I am making a website for them, but I'm not promoting them in this call. But this is just a great example of if you want to pivot here, then it's really important to, I'm going to stop the share here. To pivot here, it's really important to inform your customers what is the right thing to do and what is the wrong thing to do. There are guidelines online. I'm going to share one of those links in our recordings later on. There's guidelines from CDC. It's very simple. Some of the disinfection techniques are things like mixing a little bit of bleach, like a cap of bleach to a certain amount of water, and touching all surfaces, or a certain concentration of alcohol. Little things like this. What this cleaning company does, this is what I recommend everybody does on some level, is you make a list of these guidelines, and if you can get a third party to do it, it adds more validation, and you literally post that right up on the window saying, as of this date, this place was cleaned and sanitized, and doing this, and you can email me if you want to find out more about what all those things are. I'll put my email in here, but this is what you want to communicate, and you want to have little signatures, just like when let me put my email in here. A couple people are asking about that. So you can email me and find out more details, but essentially what you're doing is you're teaching your customers by saying, hey, the CDC has guidelines for sanitizing a place. We just did all this. Here's the signature of the person who did it. If you remember back to any bathrooms that you go in and out of it, and they've got a chart on the wall of who did it, that really inspires consumer confidence. And then after that date, you can also say, and since then we've been doing these procedures, wiping down doorknobs or countertops or different surfaces on a regular basis, that sort of thing. And that's the sort of communication I believe you're going to have to do with your customer for at least a calendar year. So in my opinion, this is just my professional opinion, if your plan is to kind of close up shop until this problem is over, I think you're not going to survive. You've got to have a plan for when you're going to open up and the virus is still out there. We may have flattened the curve. We may have it, under control a little bit. There might be a vaccine that is in the works, and there might be some good news going on forward, or there might not. There might be a larger outbreak that we don't even know of, and it keeps on spiking. But at some point, if you want to stay in business, you're going to have to open your doors, and there's going to have to be a new normal. As I like to call it, that customers are going to go downtown, they're going to consume products and services, and you're going to have to do it in a sterile way. So sanitizing the location is one way, and keeping that certificate up there is one way that people are doing that. And I'd be happy to pass your information on if anybody's interested in that. And you can also make these rules yourself. A barbershop, for example, is marketing in my area, is marketing that they're going to wear masks during every haircut for the comfort of the customer. They were already wearing gloves anyways. They typically wore gloves a lot, and they're just going to wear a mask just for the comfort and security of the customers. There are a lot of people who are dying for haircuts, and they're afraid to go out, but their hair keeps growing, so that is going to be a glut. Once people relax a little bit and they get past the fear, there's going to be tons of people who are going to want a haircut overnight. And that's kind of that crowd mentality, that herd mentality. I can't tell you exactly when you have to get back into business, but I do believe, based on everything I've seen, you're going to have to get back in business and open up shop again before this is over. There's going to be a new normal, a way to do business for a long period of time, because it's going to take so long for a virus like this to get out of the population. So with that, actually, I'd like to open it up to questions here. I got a little dry throat here. Somebody can just put up their hand, actually. You can click the option to put up your hand, or you can send a message and I will open it up. Is there anyone who has a question right now? I know I threw a lot of information at you. Actually, Mike, you have some points that I can rethink, but I'd actually like to unmute you so you can say some of those points yourself. Go ahead.
Well, I just wanted to note, because when we were talking about setting up this, you noted some of the things that people would want to carry through as messaging in any marketing in any medium that they're choosing, to reinforce consumer confidence by noting their cleaning practices. And I mentioned that Brian, who's on the call, he ran an ad for his photo studio in this week's paper, noting that he was cleaning every customer contact point before and after each visit, and random times through the day. And then when I talked to you later, you noted that was one of the key things. So I just thought maybe you might want to have him just sort of comment on that if you got any feedback from it. But he was, it just hit exactly what you were saying about it's almost for no matter whether it's a restaurant or a retailer or a service, it's consumer confidence in dealing with that business and or individual now is number one, even before is it pants I need? Is it a haircut I need? What are you doing to protect your customers?
Yeah, it's gonna shift
right.
with that. It's going to start off right now. COVID-19 is their top priority, and the product that they want is kind of a second. Thank you.
Right.
But it's going to shift where the demand is going to keep on growing, and the fear is going to start going down where the product is first, and we're just going to say that other stuff as an afterthought. Right.
And what
I unmuted Brian. Brian, you want to say something?
Yeah, just to touch base, this should be a really busy time of year for me as a portrait photographer. I have bunnies and chicks in the studio for Easter time, and it's scary, obviously. I'm just trying to clean and sanitize. I have moved to by appointment only now, so the doors are locked as we speak. But I have 4 appointments tomorrow. I'm just concerned that maybe I should have to cancel those now.
No, I would actually say you don't have to cancel them, but what you want to do is treat those appointments very, very well. What this is going to do, essentially, like in anything with marketing, you're going to have your early adopters, people who are going to go, okay, I've wanted this portrait for a long time. Now's the time. My family's at home. We're all together, and it's driving me crazy. I got to get out. He says this place is sanitized. Let's take a risk, and you'll get maybe 1 in 10 of the people who actually want your service to willing to take that risk. So the fact that you have 4 appointments coming up, that's really good. Those 4 people are going to go on social media and talk to all their friends. And as long as it's normalized, as long as some people start to actually do business transactions and we don't see, the sky fall and a whole bunch of, big outbreak from it, then more people are going to be willing to take that step forward. So it's just the herd mentality. I would suggest work with those clients and have them see you spritz and spray and disinfect and post the CDC guidelines for sanitizing a place of this sort. And I would also say that post all that stuff on social media. Post yourself cleaning. Post yourself. Hey, we had a client in today, and here's our procedure we do before, and here's what we did after. Next. Right. And for every one successful transaction you get like that, it's almost like the best advertisement you can do. It's going to lead to more and more people coming in. Okay, we got a couple of okay, so Melissa was saying it would be Melissa, do you want to I could actually unmute you and you could actually tell people your question there.
I'm probably more dangerous than the coronavirus when I'm unmuted, so here we go. Yeah, they know. So yeah, it's just I was just hoping for some ideas because, and I'm not trying to like beat a dead horse or anything, but a lot of the ideas that are easier to transition are service type things, and you are giving me ideas. I mean, even actually thinking of employees that have side jobs of cleaning, and I can, if anyone wants to contact me, I know some single moms that are great little cleaners, and maybe they can make it their job to bring themselves up to speed, and we can help support someone else in the community that we know are suffering and use them to clean our businesses, and not just a random or a larger corporation as well. Because if I can follow CDC guidelines, then I'm sure that someone who's already in the cleaning business, on the side, that would be good. But yeah, I just, I look at social media every day. I won't deny I'm in self-isolation, and so I haven't been talking so much. And I am battling being depressed a little bit right now just because of the overhead. And I don't deny everyone has their own situation, but I can't really jokingly put out there, you need a new shirt to go with your mask. Because no one's really going to come. And as Rosanna said too, we're really being advised to help stop by closing our doors and not encourage. So, I am writing these notations down, but at the same time, it would take a lot to create websites right now and curbside shopping for, like Dylan's is making hand sanitizer essentially. I can't take a long sleeve shirt and do anything except cut the sleeves off and prepare it more but I mean, literally when you don't have maybe $30,000 in inventory, you might have like $400,000 or $500,000 in inventory. You're in deep doo-doo. And closing for 2 weeks, as I know some of the other people here have voiced to me as well on the side, they have about 2 weeks or 3 weeks. And I just was wondering, I just find with Instagram and Facebook, there's a lot of yes, please, me too. Oh, that's great. We love you, as opposed to buying. And those boxes you suggested, we've contemplated those for years, but when you're seeing a box with a beautiful handbag, mascara, Tupperware containers, a whole bunch of stuff that I would love to have as well, but they're being offered at $49, again, to compete with beautiful looking boxes, and to decide what random items you could package, that would have probably required pre-planning and pre-buying from this time. So I don't want to go long because everyone knows I'm famous for that. But yeah, maybe I'm just a little frustrated because I need some ideas, I think. And you can unmute me now or mute me back on.
No problem. I love the comments. Yeah, no, you're absolutely right, and these comments do affect different business differently. I can also suggest, some things to you that might be a little bit infeasible. But for example, you talked about a lot of the box products out there. You're right; they do make their money from volume. I'm aware of some of the businesses where they have thousands and thousands of boxes. But being local, you could compete by being quicker. Quite literally, you could have somebody, see something online, a shirt that they like or something. They could have it, to their door in an hour or something like that, in a way that the other retailers can't. Now, I understand that involves somebody getting in a car and driving, and that might not be feasible. But these are just ideas. You want to brainstorm as many as you can for your business. The curbside shopping, it might not be feasible for you to have a full catalog, but you could also use social media and just post pictures of different products that you have. You could use Kijiji and even Craigslist and things like that to post actual sales of them, and then just make that your company tag in there, and you can use that platform. A lot of people are sifting through that, just curious. But I want to stress, for each and every one of those things, if you are offering any product at this point, at least, you have to make in every message, probably the first thing is, COVID-19 procedures are being in place, no touch procedures, something like that, from the product either being, washed or packaged, and then going to the client. You have to, communicate that every single time. And you are right. I will agree that at least at this stage right now, today, at the time of this recording, a lot of people are being encouraged to just shut down. But I don't see that happening for more than a couple of weeks before there has to be some sort of letting up. We're at very, very early stages. I don't think anybody thinks it's feasible that we could have all businesses shut down for months. If that happens, no one's going to open back up again, and the entire economy is in a bigger mess than like the Great Depression. So people won't let that happen because they have to make money. They have to live to survive, and that's they have, in the hierarchy of needs, there's not getting sick. There's the psychology aspect, which is what you were talking about with depression. I feel you. A lot of people are there at the same place. All I can say is that we're at such early stages. Don't think that what's going on this week is every week going forward. This is, I think, the extreme reaction to what's going on. And then there's, even our MP and MPP were saying that new announcements are going to be coming down. They even know of some things, but you can't make that announcement until the announcement happens. And there will be things that will improve consumer confidence. We all want that to go up. So just, brainstorming right now. Yes, you might be shut down for a couple weeks, but then how do you open up? What are your policies and procedures if somebody does want something in the meantime? And like I said, some of those options like the, Kijiji and other places that you could still be offering your products for the window shoppers. You might not even do it for sales just yet, but it'll be for people who are window shopping. All right. A question here about a gymnastics center who are closed currently. Yeah, that's one of those ones that will probably, I hate to be the bearer of bad news, but any place that people are sweating, and in close proximity together, they're breathing heavily, touching equipment, that's probably going to be on lockdown a little bit longer than other places. It's actually conceivable that restaurants may even open up sooner than, say, a gym, mainly because of that, that greasy feel, the touching everything and all the surfaces. I could be wrong about this, and but that would be my prediction, and I apologize about it. What you can do in the meantime, I would say that one-on-one lessons are possible with certain procedures. You just wouldn't have group things. You wouldn't have open gym, that sort of thing. You might also have online lessons. You might have one-on-one training via video. I love gymnastics myself. I do a lot of body weight exercises. So you could have somebody doing training at home, things that they could do from home to train and keep up in their routine. I'm not sure. In your gymnastics center, you probably have a mixture of athletes and novices, so you'd have different offerings for different ones. The novices can keep their skills up and not lose their strength, and the athletes can keep competitive. And then you could offer video conferencing, video calling. You can actually get an account through Zoom. I'm not selling it or anything, but you can get an account through Zoom that's free, that you can do a lot of one-on-one type stuff. To do a crowd like this, you do have to pay though. So that's a couple of suggestions for there. if you're able to do private lessons one-on-one in the gym with those cleaning policies, yeah, I think that is definitely a possibility if you have one-on-one type situations, and you can have a contained environment. The main thing is having a gym of several people seems to be the problem. So there's even people who are personal trainers who are talking about doing, well, they're not talking about, they're doing it right now. They're doing at-home training via video conferencing. So like I said, the demand doesn't go away, but you do have to find a partially virtual, probably, way to facilitate that. And then so maybe you do like 9 exercises at home, and then you do the 1 session in the gym, and you can still give a good quality product with that. All right, some great yeah, the return rate for clothing, it does really depend. I'm not sure about the 40 to 60% return rate. I've heard different numbers elsewhere, but if you're in that business, I won't challenge you on that for your particular business. But what I can say is that you could have, there's a number of things with clothing that people can do. Clothing right now is not it's not a purchase. People do see it as a luxury for like formal clothing or going out, but you could be offering comfort clothing, for staying at home. I can tell you that I went through all my pajamas and realized I needed more jogging pants and things like that because I wanted to be comfortable at home. I just simply hadn't had that many home days in a row before. So there may be needs for comfort clothing, and you could kind of market it that way, saying, hey, you want to feel comfortable at home, you're staying at home, fight the blues, fight the COVID blues with with these specific picks from our store. And oh, by the way, we're local, so you'd be supporting local business. And if you act now, we could get it to you by the end of the day. We could have it dropped off at your door with a no-touch service. I know that requires a little extra work on your part, but it does keep the lights on. It does keep the business going. Sam has to do another call. Why don't I open things up for Sam and Mike? Oh yeah, and the comment for refunds and membership. Just Sam, just before you go, I'm going to unmute you. I'm also going to unmute a few other people here, Dean and Mike, and see if we can get a final discussion. And I want to thank everybody for being on this call as well. So Sam and Mike, you are unmuted. And Brian, you're unmuted.
Thank you. If you were talking about Brooke, she had to go to a call to call her boss at the gym. She really did appreciate all the comments.
All right. Any other questions? Mike, do you want to do some closing thoughts? And I think
Sure.
Sam, if you're still around.
Sure. Well, I can't see if Sam's still on or not, but I think we got the ball rolling with some good basic information, both on the virus itself, because I think it's important that everybody have an understanding of what's going on. And it is a changing circumstance, and maybe Dean might want to address that sort of on the way out the door as well. Dean, do you want to just touch on where you think things are and how they may evolve, or how to brace for different things?
I have to unmute Dean.
Oh,
sorry.
Here, I can just hop in very quickly.
Yeah, go ahead, Sam.
Oh, you're good there, Sam.
Yeah.
Sorry.
Mike, thanks for organizing this, Dave, as well. It's good to hear what's going on, and I think there's a bunch of takeaways from this, especially around supporting local businesses, and I think Dean and I have a role to play in making that awareness as well. Lots of things happening on the provincial government side. I know there's another announcement today at 12:30 with some more news, and there'll be more announcements in coming days. Because this has moved so quickly, some of the legal side of things is getting stuff in order to roll out support programs and to roll out changes legally. Some of those things do take time. I was wrong. I said Thursday, March 25th. It's actually Wednesday, 25th is when we're posting an update with regards to support. So please stay tuned to that. And if anyone has any follow-up, please reach out. A lot of good things to take away from this, and also just reiterating how difficult this is, but everyone working together, we can get through it.
Dean?
I'll just add.
All right.
Go
ahead, Dean.
I just add, listen, I know these are very tough times. I'm not particularly happy with what the federal government has offered in terms of supports for small business. And the challenge is right now is that, small businesses are on the front lines. You guys understand that, Dave. You've given me some things to think about, like, normal routines. There's some practical help here, and I appreciate that. But let's not make any mistake about it. These are unprecedented and uncertain times, and I really believe it's going to get a lot worse. And I don't know if people want to hear that, but the reality is, if you look at what's happened in China, in Italy, and a number of other countries, it may get a lot worse before it gets better. And so I'm going to continue to push for small business supports, because I think at the end of the day, our communities rely on small business, and it's the lifeblood of the community. And so while the federal government has come up with some good supports for individuals and some other larger companies, I think they've missed the mark totally on the small business side. And so we will continue to push to see if there's more things that can happen, because I get it. You're a small business and you got a shop on Main Street and no one's coming in. It's not exactly easy to be setting up a website in 24 hours and trying to change your whole business model. So Dave, thank you for the suggestions. More, I think, needs to be done, but as I say, we got to keep the green light thinking going to try and get out of the box and try and figure out different ways to make things happen.
Absolutely, absolutely. And also, Jeff Jordan, I was told the mayor here is online, and I unmuted him. Sort of just hit you with this, Jeff. But do you have some comments for people?
That's okay. I just want to thank the DIA for putting this together and getting the information out. We at the town are trying to get as much information out as we can, but we're kind of following from the federal, provincial, and then the region. So we are. I'm certainly updating my counselors daily with any updates from the region, and following suit with updates from the province as well, and the feds. As Dean said, it is unprecedented times, and there's no playbook for this. So we are just trying to disseminate as much information as we can, and just try to keep people positive and looking forward of ways to overcome this. From my other side, my farming side, farmers are very well equipped to deal with fast-paced change. And I think that we're well situated, like taking the farm model. Farmers will get product and get things to market, and they will find innovative ways to do that in a crisis. So I just want to reiterate everyone else that we just really need to stay positive on this and find innovative ways to overcome this. So thanks. And thanks again, Mike.
Yeah. Thanks very much, Jeff. Yeah, and I just want to reiterate some of the points here. Is that Black Swan events, all of them are unprecedented when they happen. So that's why I say that there is a pattern that you can see, and hopefully that'll give some comfort. But of course, realize that this may be different, it may be completely different. But this is our best guess, essentially. So just to reiterate some of the points that I was saying before, taking care of yourself and your body, and hand washing is the single biggest thing. Negotiating with your creditors, negotiating with tax and lease payments and anything you possibly can to try to bring that down, and negotiating with your staff, being creative and offering different services. This obviously is very different depending on what business you're in, and you might consider completely changing your business model to try to meet the demand, but follow the money, and that can be a way to survive and even thrive eventually. And then communicate. You have to make policies that follow certain guidelines. You have to communicate to your customers that you're one of the good people that is following these policies and getting it out there. And also realize that you have to plan for all the stages. So this is the panic stage. And then shortly after that, there will be that new normal stage. Wherever it starts for you might be different than when it starts for other people. There may be food companies that can do delivery, and their new normal is tomorrow. And other people, like I said, like the gyms, workout places, things like that, their new normal might be very far in the future. So find what your new normal is and plan accordingly, and then at least you have a strategy, at least you have a plan, and you can actually send that out. I suggest even working on it like you do a business plan or a launch plan for a product. This is where we expect, and then that new normal period of time, and then also plan for that recovery. Put yourself in that mental headspace. Hopefully it'll help with the depression and stress, and then share that plan with everyone else. People will have more confidence in you and probably give you a better deal if you are showing that they have a plan. Banks certainly like that, for one example. And Mike, do you want to have any closing thoughts?
No, good information. As I noted, we'll be posting this conversation on the website and circulating the link to the various municipalities as well. Looking forward to your follow-up pieces, and maybe in a couple weeks' time, we might do seeing how the landscape changes, we might take a shot at doing another one of these, or a logical step too, if you will.
All right, and I'm just going to put my email. People may have questions they want to ask me directly. I want to be available to all you folks, so I'm just going to put my email in here. I sent it just to Mike alone, so I got to adjust and send it to everyone. There we go. david@farrowcommunications.com. Everyone, be safe, and don't panic, and realize that you're not alone in this. We're all in this. We're all doing this, and it's the actions that we take right now that are going to determine how we get through this. Don't give up, but you do have a fight ahead of you, and I'm in it with you. We're all going to fight together. That's what we do, right? I want to thank you very much for your time, everyone, and I appreciate the opportunity, and God bless.
Thanks, Dave.